Welcome to the fourth video of this series related to curriculum development in health professional education. My name is Mohamed Hassan Taha. I'm a medical educationalist with the aim to advance health professional education and the passion to advance health professional education to improve the population health. This video is part of the video series related to curriculum development in health professional education, and today's video will be about outcome-based and competency-based education. The video will talk about what is outcome-based education and the concept related to outcome-based education, competency-based education, the concept of entrustment, IBEs, competency framework. So all these issues will be and concepts will be discussed in this video. So what is outcome-based education? Outcome-based education is an approach where the curriculum is designed, deliver, and assessment are driven by learning outcomes. And the focus here is on the end product and the competencies of the graduates rather than just the content, what to be taught, what to be taught, what to be assessed. So it is a product focus, emphasize that this sort of healthcare professionals is produce skill with good behavior and good knowledge instead of the traditional emphasis which was on the process and the content. The outcome-based education has a clear specifications, so all required abilities and competencies are clearly and unambiguously specified at the outset, and these outcomes guide everything, teaching and learning, assessment, and so on. So it's a backward design. What do you mean by backward design? Start by the final outcome and design the curriculum. Let's see this here. This is example of backward design. We have the outcome at the institutions, then the intended learner outcome of the program, then of the course, then of the unit, then for the lesson. This is the way that we design the curriculum. But when we deliver it, we should think when we develop the lesson plan or the session plan, the workshop or the clinical skill session, we should align this with the competency framework at institutional level or at country level. This is very important concept that need to be clarified area in this video. So the main aim and the reason behind introducing outcome-based education, health professional education, is to address the existing gap, because the traditional or the classical curricula training often produce healthcare professionals lacking some important concepts, competencies related to practice. They may be knowledgeable, they may be skillful, but they lack important concepts related to practice and to improve the population health and satisfying the patient needs. The healthcare system is evolving over the time. The demand and the need of the healthcare system now is different from the demand 10 years ago, and this is very important. And it also addresses accountability, because the society and the employer demand transparency about what the new healthcare professional should actually do. So this sort of or approach of education make the medical school and health sciences school accountable to the community. Now let's see the key principle of outcome-based education. The first principle is outcome drive everything, drive the teaching, the content, the assessment, and everything. The second key principle is the student-centered approach. It is flexible, it's not time limit. Unless the outcome or the competency achieved, we should not progress the learner to the other level. It's a performance-oriented, and it's characterized by the transparency and by the clarity. Comparing the traditional or the classical approach and the outcome-based approach, the classical approach is time-based rotation or course, time-based course, and here is a progression course. Now moving from the outcome-based to the competency-based and to entrustment, let us clarify this term. The outcome-based education defines what graduates should achieve, while the competency, it is a structure like roadmap, like blueprint, how competencies develop and judge. The entrustable professional activities translate the competence into real clinical work. And the core message here, comparison with these concepts together, the outcome-based education sets the destination, The competency-based medical education builds the roadmap, while the entrustable professional activity define the real-world task. Now, let's zoom in into competency-based medical education. What is the competency-based medical education? Competency-based medical education is approach where the learner progress by demonstrating competencies in a clearly defined domains. And the key feature of the competency-based medical education, we should have explicit competencies, developmental milestone, we should have workplace assessment that make sure that these competencies has been achieved, and they should be individual progression. For this reason, they should be individual, like portfolio or logbook for everyone. And the message should be clear to our students that you advance when you can perform safely and independently. And this is what we mean by entrustable professional activity. Let us see it with detail. So what's the content, what is the process, and it is governed by the graduate outcomes, and these graduate outcomes is delivered by the existing competency framework at country or national level. And this should determine the entry level of the students. So the competency-based medical education, it's a roadmap for the outcome-based education. It's an approach. It's outcome-oriented, it's learning-centered, and programmatic assessment should be considered here. And flexibility related to the duration of the training. So it is a paradigm shift, the competency-based medical education, from the content hours, from the assumption that the more hours we assign for the training, to the content mastery. Some learners may master skills in a shorter time compared to the other. The focus, it is a paradigm shift from focus on teaching to the focus on learning. And the time is variable. And the greater emphasis here on the needs. So we define now the outcome, the competency-based education, and let us zoom out to the entrustable professional activity. So entrustable professional activity, key task of discipline that practitioner need to be able to perform. We have also milestones. Milestones are the ability expected of healthcare professionals at the stage of development, and based on some competency framework here in this slide, CAMED has been given as example. So to summarize the relationship between competency-based, outcome-based, and EPAs, let us see the next slide that clearly defines the central goal of why outcome-based education is needed. Because in the past number of years, multiplied by the number of the cases, assume the competencies. So it is the training is a time-based learning models with anticipation that having this number of years, number of cases will lead to competent healthcare practitioner. Why social accountable educations? In competency-based medical education, social accountable education equal to prove the competency. And in order to prove the competencies, we need to have this defined, clear, entrustable professional activities, masteries, focusing outcomes, emphasizing the abilities, and including the individual training and so on. So these very important things that need to be considered. And so now let's move from the outcomes to the competence to the milestones. And for each competence, each outcome is broken to different level. For example, let's see the clinical reason as example when we think about the milestone. So level 1 may be recognizing the key system symptom. Level 2 forms the differential diagnosis. Level 3 managing independently, and level 4 supervising other effectively. You will find some terms used interchangeably in health professional education, and let us clearly define them. So what do you mean by competency? What do you mean by the outcomes? And what do you mean by objective? Competency is a general statement detailing the desire, knowledge, skills, and responsibility and attitude of students graduating from our course or program. Objective is a very general statement about a larger goals of a course or a program, and the outcome is a very specific statement that describes exactly what the students will be able to do in some measurable way. So a competency framework, it is a model that broadly describes performance excellence with the professionals, and this competency framework usually include number of competencies that are applied to multiple roles within the healthcare professionals, and the students must be able to achieve them by the end of the training. And you'll find several competency framework. For example, Canada can make US, CBME, GMC, UK, and in the Middle East, you'll find like Saudi Met in Saudi Arabia, Emirates Met in United Arab Emirates, and there are many other competency framework. So we were talking about the outcome-based, competency-based medical education, milestones. So can we see clearly the relationship between the outcome, competency-based, EPAs? Yes. This diagram shows a clear relationship between them. So here the competencies, and in each competencies there are many milestones, as we can see in the previous slide. And these competencies, when aggregate with each other, will develop a domain of competencies. And this domain of competencies, when they aggregate together, they develop the entrustable professional activity. So, entrustable professional activity, and we will define it in the next slide, it is a collection of domain of competencies, because we cannot directly measure the competencies. We can directly measure the entrustable professional activity, where we can trust the professional to practice safely. And so entrustable professional activities, as you can see here also, it is a domain of competencies, and this domain of competencies constitute of competencies, and each competencies has milestones. For example, these 3 milestones develop these competencies, and these 2 competencies develop domain of competencies, and this will contribute to the entrustable professional activities. And I highly recommend you to read this AME guide 140 about the descriptions of the entrustable professional activities. Let us dissect this term, EPA. E for entrustable, that means the act that requires trust. And B for professional, that means it is confined with occupation, nursing, midwifery, medicine, dental, health science, and so on. An activity, that means task that must be done. So the act that requires trust within the defined, confined to the occupation, and the tasks that must be done and must be observable. And it's different level, starting from having the knowledge. This is the lowest level. Being able to practice under supervision. This is the second level. Able to practice under moderate supervisions, independent practice, and able to supervise and instruct the other. So this is the different levels of the IBA. So it is very important to have this IBA in EPAs in the curriculum, because both trainees and supervisor will benefit from this EPAs in terms of the clarity of the role, the focus for the assessment, and for the overall practice. And this is the level need for each level of the EPA, from the first level to the highest level. And you can take a screenshot of this screen to see this 5 level of the EPA. Thank you so much for watching this video, and looking forward to see you to the 6th video, which will be about writing learning outcome.